Good morning. We'll continue our topic about arrhythmia. We already talked about how the normal electrical activity of heart works. We talked about supraventricular tachycardia or fast tachycardia from top chamber of the heart. Now, briefly, I'm going to mention what is the ventricular arrhythmia or tachycardia or fast heart rate from bottom chamber of the heart. When the tissue in the bottom chamber, for any reason, starts to fire electrical activity very fast or goes to fibrillation, which basically the bottom chamber, instead of regular squeeze, they are going to just shiver, called ventricular tachycardia or ventricular fibrillation. Those are much more concerning abnormal rhythm compared to fast rhythm from top chamber of the heart. The ventricular tachycardia or ventricular fibrillation could have different reasons. Some of the reason is congenital condition of the electrical system of the heart, which creates those abnormal rhythm. We could have some abnormality in electrolyte balance around the channels in the myocardial cells of the bottom chamber of the heart, or it could be due to blockage in the heart artery, which limits the perfusion of the blood to the tissue of the bottom chamber, called ischemia, and ischemia triggers those abnormal rhythm. At the same time, sometimes there are scar formation in the muscle of the bottom chamber of the heart that creates a kind of circuit and is the reason for those abnormal rhythm. All of those things, as I mentioned, are concerning. We want to make sure the chance of recurrence or persistent one is really low, because they can cause cardiac arrest and they could be the reason for sudden death. In regard of how can we diagnose those, there are different, it's a very wide spectrum topic to talk about that. But in general, whenever we have any concern about possibility of them, one of them is monitoring the cardiac rhythm by cardiac monitor or loop recorder, or inducing those kind of rhythm during electrophysiology study in lab, that we try to trigger the bottom chamber and see if we can bring them up. One of the device or procedure we do in patients that they have those ventricular tachycardia or fibrillation is putting a defibrillator or AICD, which is monitoring the heart 24/7, and if any of those rhythm happens, can shock the heart out of that rhythm and survives the patient. So this was just to give you a kind of brief idea of what are the arrhythmia from ventricles. Of course, to further getting information or learning or knowing if there is any concern about that for any patient, the cardiologist and electrophysiologist, they can do the further workup, going through history and do what is needed. I hope you have a good day. I hope this was helpful for you to understand some part of arrhythmia. Enjoy your day. Love each other. Be passionate, enjoy your life, and be courageous. Thank you. Bye-bye.